Welcome to the Radio Revenue Podcast. Welcome, curious minds. Today we're taking a deep dive into an area that, well, it might seem a bit niche at first glance, but it really touches millions of lives globally. We're talking about the business and impact of a company called ResMed. Yeah, they're a giant in the medical device and healthcare software space, and their latest 10K filing gives us this incredible window into their world. Our mission today is to, cut through the jargon, pull out the most important nuggets of knowledge, and basically give you a shortcut to being really well informed about a company sitting right at the intersection of health, tech, and policy. We want to help you understand not just what ResMed does, but why it matters, and maybe uncover some surprising facts lurking in plain sight.
Indeed. And you've provided us with ResMed's Form 10K for the fiscal year ending June 30th, 2025. Now, for anyone unfamiliar, a 10K is, well, it's a super comprehensive annual report public companies file with the SEC. It gives us a really detailed, inside look at their operations, financials, the risks they face. This document, honestly, it's a treasure trove. It lets us connect the dots between their finances, their innovation, and the whole healthcare landscape.
Okay, let's unpack this then. ResMed is described as a global leader in medical devices and cloud-based software apps.
Yeah.
What exactly are they trying to solve? What's their core thing?
At its core, ResMed is focused on diagnosing, treating, and managing respiratory disorders. Think sleep-disordered breathing, primarily obstructive sleep apnea or OSA, but also things like central sleep apnea, CSA, and chronic conditions like COPD, that's chronic obstructive pulmonary disease, and various neuromuscular diseases too. Their main goal really is to improve patient quality of life, lessen the impact of chronic disease, and ultimately lower healthcare costs by enabling care to shift.
Shift from hospitals.
Exactly. From expensive hospital settings to the comfort and efficiency of the patient's own home.
So it's kind of a two-pronged approach, right? The actual devices and the software side. Can you give us a quick breakdown of their main business segments?
Absolutely. They operate under two primary segments. First, you've got sleep and breathing health, which covers all their medical devices and therapy solutions. And second, there's residential care software. This provides business management software, software as a service, to residential healthcare providers. This dual focus lets them offer really integrated solutions from the diagnostic tools and therapy devices themselves, right through to the software that streamlines patient care and helps providers operate. It's quite an ecosystem.
And they have a massive global footprint, too, you mentioned. How big are we talking?
Oh, definitely. They employ over 10,600 people and sell their products in more than 140 countries. They do this through a mix of their own subsidiaries and independent distributors. It's a truly international operation, making their impact felt pretty much worldwide.
Okay, here's where I think it gets really interesting. ResMed's core business is all about sleep apnea. Now, for many people, myself included perhaps, it's just snoring. But the 10K makes it really clear this is way more serious. What is obstructive sleep apnea, and why is it such a big health concern?
Yeah, what's fascinating here is just how misunderstood and, frankly, how impactful OSA is. It happens when the upper airway temporarily collapses during sleep. This leads to apneas, that's a temporary stop in breathing, or hypopneas, which are near closures. This causes a really crucial drop in blood oxygen. That drop triggers the central nervous system to basically wake the person up, often just briefly, subconsciously. Sufferers can go through 10 or even more of these cycles every single hour. It severely messes up sleep quality, often without them even realizing it. It is, incredibly exhausting for the body.
That sounds awful, and definitely more than just snoring. So what about the scale? How many people are actually affected by this?
Well, this brings up a huge point about public health awareness. An older study from 2013 estimated about 26% of adults aged 30-70 had some form of OSA. But more recently, a 2019 Lancet study estimated that mild to severe OSA impacts over 936 million people worldwide.
900 million?
Yes, it's a huge number. Over 424 million of those have moderate to severe sleep apnea. And just in the U.S. alone, it's about 54 million Americans impacted.
Over 900 million globally. That's just staggering. But the document also points out a really critical issue. The diagnosis rates are incredibly low. What's causing that gap?
Exactly. That's the kicker. Despite how common it is, less than 20% of those with OSA in the U.S. are diagnosed or treated, and that number drops to 10% or even less in other markets. The reason cited is basically a lack of awareness, both in the medical community and among the general public. Common symptoms, things like being excessively sleepy during the day, fatigue, loud snoring, high blood pressure, irritability. They're often not recognized as signs of OSA because they're quite nonspecific. It really is a kind of silent epidemic.
Okay, so what does this all mean for overall health, beyond just feeling tired? Is it just about sleep quality?
Not at all. If we connect this to the bigger picture, the 10K highlights a really strong link between sleep apnea and serious cardiovascular and metabolic diseases. For instance, studies show sleep apnea is present in roughly 83% of patients with drug-resistant hypertension. That's high blood pressure that doesn't respond well to medication. Also, 77% of patients with obesity, 76% with chronic heart failure, and 72% with type 2 diabetes.
Wow.
Yeah, and it's also linked to increased risk of stroke and heart attack, and even impaired cognitive function, which can lead to more traffic and workplace accidents. This silent epidemic has really wide-ranging and serious consequences.
Okay, given this huge unmet need and these serious health links, ResMed clearly needs a robust strategy. What are the key parts of their business strategy for growth, according to the filing?
Right. Their core vision is really about enabling everyone to achieve their full potential through better sleep and breathing, with care delivered right in their own home. To get there, they've laid out 5 key pillars in their strategy. Pillar 1 is all about growing and differentiating their core sleep apnea portfolio, basically continuing to develop smaller, quieter, more comfortable, and crucially, more connected products. They're bringing in AI and machine learning to boost therapy performance and the user experience. A good example mentioned is the April 2025 U.S. launch of their home sleep apnea test, Night Owl, makes diagnosis simpler. And to expand their diagnostic streamlining, in May 2025, they acquired Virtuox, that's an IDTF, an independent diagnostic testing facility. This lets them bring more diagnostic services in-house.
That makes a lot of sense. Simplifying diagnosis seems like a massive step. And it sounds like that ties into their second pillar, which is about market growth through awareness.
Exactly. The second pillar is accelerating market growth through awareness. Because so many people are undiagnosed, just educating the public and medical specialists like pulmonologists, cardiologists, neurologists is a huge part of their strategy. They partner with groups like the National Stroke Association and the American Heart Association to really hammer home the critical link between sleep apnea and these other serious conditions. They're even getting involved in occupational health dangers, especially for the transport industry, and supporting academic research at top places like UC San Diego and Harvard Med.
That's a really comprehensive approach to boosting health literacy. What about expanding beyond just sleep apnea? Is that part of it?
That's their third pillar, capitalizing on broader sleep and breathing health adjacencies. This means looking at unmet needs in areas like insomnia, COPD, other respiratory issues, especially as, pharmaceuticals and consumer tech are putting more focus on sleep health generally. They're innovating breathing health products and therapy software like AirView for remote patient monitoring. Their supported research has even shown benefits of adding non-invasive ventilation for severe COPD patients already on oxygen therapy.
So they're not just selling devices, they're really building out a whole connected system, like an ecosystem.
Precisely. Their fourth pillar is investing in an integrated, intelligent digital health ecosystem. Digital enablement is absolutely central to what they do. Their secure cloud apps and devices provide connected care. This lets fewer professionals manage more patients, and it empowers patients to track their own health outcomes. They leverage a massive installed base, over 30 million cloud-connected devices on their AirView platform, and 10 million patients on their MyAir platform, which helps individuals manage their therapy.
Okay, and how does that connect with their final strategic point? What's the fifth pillar?
The fifth pillar is aligning solutions to enable smarter, connected care. Their residential care software solutions, names like Braintree, Healthcare First, Matrix Care, these are key to supporting the sleep and breathing health side. These platforms help providers in areas like home medical equipment, skilled nursing, senior living, home health, hospice, basically helping them operate more efficiently. Essentially, these tools help keep people out of hospitals and manage their care effectively at home, and these software solutions currently support over 160 million individual patient accounts. It's huge.
That's a truly comprehensive vision for growth and impact. But as we know, healthcare is notoriously complex. It's a minefield of regulations and economic shifts. What are some of the biggest challenges ResMed faces from that side?
Oh, it absolutely is a complex environment. The regulatory and economic landscape brings significant external pressures. One major area is U.S. healthcare reform. They specifically talk about the impact of the Medicare competitive bidding program. This basically acts like an auction, forcing medical device companies like ResMed to compete heavily on price for their products. This has led to reduced payments for devices like CPAP, that's continuous positive airway pressure, and other respiratory assist devices. Even though it's been paused temporarily, it's expected to restart bringing those financial pressures right back.
Ouch.
Yeah, and they also face ongoing Medicare sequestration payment reductions. These are automatic, across-the-board cuts to Medicare payments, usually around 2%. The filing even notes that the Consolidated Appropriations Act of 2024 and a later CMS rule that Centers for Medicare and Medicaid Services finalized a 2.93% cut in Medicare payments under the physician fee schedule for calendar year 2025. Although another act, the One Big Beautiful Bill Act in July 2025, temporarily bumps it up by 2.5% for 2026. It just shows the constant shifting ground beneath their feet financially.
So it sounds like a constant battle against downward pressure on pricing and payments in the U.S. What about things like Medicaid and telehealth? Do those come into play?
They do. That same One Big Beautiful Bill Act also includes provisions that could cut federal Medicaid funding by a huge $930 billion over 10 years. It could also potentially reduce enrollment in the ACA, the Affordable Care Act, which might decrease the number of people eligible for coverage, impacting patient access. Plus, Medicare telehealth flexibilities, which really expanded during COVID-19 and helped with remote care, they're currently set to expire at the end of 2025. If those aren't extended, it could definitely hurt OSA diagnosis rates, making it harder for patients to get assessed remotely.
And what about for veterans? Is the VA involved here?
Yes, there's a proposed 2022 VA rule change for sleep apnea that could significantly slash disability ratings for veterans using CPAP. Now, existing ratings are grandfathered in, but new claims would be evaluated under these new, tougher criteria that could potentially discourage treatment among veterans needing it.
Wow. Okay, beyond government programs, what about the legal and compliance side? What risks do they face there?
They face a really intricate web of legal and compliance risks. They're subject to a whole host of fraud and abuse laws. Things like the federal anti-kickback statute, the False Claims Act, the Stark Law. These prohibit certain financial relationships. This became even more critical after they acquired VirtuOx. Then there are transparency laws like the Physician Payment Sunshine Act, which tracks payments to doctors. And of course, crucial data privacy regulations like HIPAA, the Health Insurance Portability and Accountability Act. With VirtuOx, ResMed is now considered a covered entity under HIPAA, which really ramps up their privacy obligations.
That is a lot to navigate. And I noticed the filing also mentioned something about FCPA enforcement. What's that?
Yes. The FCPA, or Foreign Corrupt Practices Act, it basically prohibits companies from bribing foreign officials. The document highlights a pretty dynamic environment here. It notes the Trump administration's temporary pause on FCPA enforcement back in February 2025, followed by new guidelines that emphasize aligning enforcement with U.S. economic interests. For a global company like ResMed, this just creates a constantly shifting compliance target.
And they've had some past legal issues too, right? Did the filing mention that?
It did. The 10-K mentions a significant 2019 settlement with the DOJ Department of Justice. ResMed paid $39.5 million to settle allegations about providing free services and products to DME companies, that's durable medical equipment providers, and sleep labs. This also led to something called a Corporate Integrity Agreement, CIA, which is basically a detailed compliance plan overseen by the government. Most of its obligations actually expired in December 2024, but it's part of their history.
And for the global operations, how does international regulation play in, especially Europe?
International regulation is definitely a constant factor.
Yeah.
In the European Economic Area, for example, medical devices have to comply with the really strict EU Medical Devices Regulation, MDR. These rules are much tougher than the older directives. They involve detailed conformity assessments, getting that CE mark, which is like a safety certification for products sold in Europe, and using a central UDEM database for reporting incidents. There are transition periods for older devices running through late 2027 or 2028. Depending on the device type, so this is a big ongoing compliance effort for them.
Okay, finally on risks. What about broader business risks they identify, beyond the regulatory stuff?
They list various other business risks. This includes intense competition, especially from new technologies. For instance, they mention GLP-1s. Those are the new class of weight loss drugs.
Right, the ones everyone's talking about.
Exactly. They could potentially reduce obesity-related OSA, which might impact ResMed's market. They also face risks from supply chain disruptions, particularly for electronic components, which we've seen affect many industries. And then there are currency fluctuations for a global company, and even the evolving landscape of AI regulation and the potential for AI bias in their connected health solutions. It's a really multifaceted risk picture.
Okay, shifting gears a bit. Beyond The products and regulations. The strength of any company often comes down to its people.
Uh-huh.
What did you find interesting in the 10K about how ResMed manages its human capital and corporate governance?
What's really quite fascinating here is their comprehensive approach to human capital. They've got about 10,600 employees globally, and they put a strong emphasis on fostering an inclusive environment. This is underpinned by a code of business conduct and ethics that covers everything from workplace behavior and discrimination to health and safety. They focus on attracting and keeping talent through several key initiatives. Well, for instance, they prioritize learning and development. They offer global mentorship programs, including a cool reverse mentorship program for intergenerational learning. Plus, enterprise-wide training on things like operational compliance and that FCPA we mentioned. They also have a strong focus on strategic inclusive development. There's a global council advising on inclusion efforts, and they prioritize accessibility and inclusivity in their product design, research, and patient outreach. And critically, they focus on employee engagement and well-being. They run annual global engagement surveys to get feedback and offer health and well-being programs, including, interestingly, sleep apnea screening for their own employees.
That sounds like a very proactive approach to their workforce, even screening their own people. And from a financial governance perspective, what does the 10K tell us about how they manage their finances and corporate oversight?
Well, from a financial governance standpoint, their board of directors oversees enterprise risk management. That includes cybersecurity risk, which gets reviewed annually by their chief information security officer. The document also highlights their active share repurchase program. As of June 30th, 2025, they had authorization to repurchase another 10.8 million shares. They've also historically paid quarterly dividends, with the latest one declared on July 31st, 2025, for payment in September 2025. And to align employee interests with the company's performance, they use various forms of stock-based compensation, things like restricted stock units, RSUs, and performance-based restricted stock units, PSUs. These are basically promises of company stock that vest over time, often tied to hitting specific performance goals.
Okay, so wrapping this all up, what does this deep dive mean for you, our listener? We've really dug into ResMed, a company that's clearly not just making medical devices.
Right.
They're building this vast digital health ecosystem, tackling a huge, silent global health problem, and navigating this incredibly complex maze of regulations and economic pressures.
Yeah, this deep dive into their Form 10K really highlights that intricate dance between innovation, public health needs, and, well, policy and economics. Understanding how just one company like ResMed operates can give you really unique insights into broader market trends, the constant push-pull of regulatory challenges, and the huge opportunities that exist in addressing these massive unmet healthcare needs. It really makes you think about how knowing about one area can inform your understanding of so many others.
Absolutely. So the next time you come across a seemingly dense document like a 10K, remember, there are always fascinating stories, surprising facts, and crucial insights hiding in there. They offer immense value if you just know where and how to look. This knowledge isn't just for investors or industry insiders. It's really about understanding the forces shaping our world and, importantly, our health. It was a Revenue Radio podcast. Thank you for watching. Please like, subscribe, and hit the bell to stay updated with our latest analyses.